Doctor, can you explain what hereditary cancers are and what are the roles of genetics in that?
Usually we see cancers at a later age, right after 60 is a common age time for most common types of cancer to occur. So whenever there is an early cancer, or whenever someone has cancer multiple times, or multiple different types of cancers, cancer coming again and again, rare types of cancers are coming, all these we think of it, why has this happened, right? Why this is happening again and again, why this is happening in multiple family members and all those things. And one of the major reasons why this happens is because of this hereditary cancer spectrum or genetic forms of cancer. We can say all cancers are not because of any genetic defect that is running in families. Only around 5 to 10% of cancers are, but these genetic cancers differ very much in their treatment, in their recurrence risk, what all prophylactic or preventive measures we can take, and also the risk in their family. So it is important to identify them. So why does this happen? So a lot of times we have talked again and again about this in our channel, that all our bodily functions are being taken care by different forms of proteins, right? Everything in our body is being taken care by different proteins, and these proteins are coded by the DNA. So whenever there are defects in the DNA, it translates to defective proteins and hence the disease. So similarly, in our body there are many proteins which help us not get cancers. So we call them tumor suppressor genes. So they help us by preventing cancers in our body. But the problem is that sometimes this DNA which codes for these proteins becomes defective, and these proteins become ineffective in protecting us against these cancers. That is why these people are at a higher risk of getting certain forms of cancers. Again, we know that DNA is shared within the family. Everybody, the siblings, the mother and children, the grandparents, everybody share the same pool of DNA among themselves, and that is why a person having a defect in the DNA, their first degree relatives, parents, siblings and children might also harbor the same defect, and they might be normal now, they might not have had any cancer till now, but they might also be at a higher risk of getting these cancers.
Doctor, how can patterns of various cancers in a family point to an inherited risk?
Yeah, it's true that we usually see certain patterns of cancers in these families, because certain proteins are associated with a higher risk of cancers in certain organs. For example, the BRCA1 gene, that is the most popular one that everybody knows, especially after uh, the actress Angelina Jolie was diagnosed with this condition, and she opted to remove both her breasts to prevent or to reduce the risk of having breast cancers. So that is one of those proteins. The BRCA1 and BRCA2 and a closely related set of genes we usually see associated with breast and ovarian cancers. So we call it HBOC, hereditary breast and ovarian cancer syndrome. So we usually see breast, ovary, pancreas, prostate, sometimes stomach and skin also associated with these set of proteins. That is one pattern that we commonly see. Another common pattern that we see is something we call as Lynch syndrome, where we have colon cancers along with maybe uterine cancers, stomach cancers, sometimes brain cancers, polyps in the colon. All these can be associated with different types of either Lynch syndrome or different types of colorectal cancer syndromes. There are other types in which certain types of thyroid cancers can be genetic. It can be associated with cancers in other glands. We recently had a case, a rarer case, where kidney cancer was associated with a syndrome called VHL, and he was otherwise operated for the kidney cancer, but since we did the genetic testing, we found out that he might be at a risk of other cancers also. We did an MRI and we found that he was actually having a early stage brain tumor also. If we had not done this test in him, he would have gone on to develop a severe form of brain cancer. It could have been life threatening also, but since we detected it early, we were able to treat it well in time. So these are the common organs that we see affected with genetic types of cancers, but even normal blood cancers, bone cancer, lung cancer, all can also be associated with the similar hereditary forms of cancer. So whenever such a pattern or such different forms of cancer start occurring in a family or in the same individual event, then we should suspect that there could be some genetic form of cancer running in the family.
Doctor, when should genetics be considered and who might benefit from testing?
For all cancer patients, we do not recommend this form of genetic testing. So we specifically look for certain red flags. So we already discussed earlier, someone having early age of cancer. We are commonly seeing more and more incidence of colon cancer increasing in young patients. So anybody who has had cancer less than 60, especially if less than 50 years of age, should be at a suspicion of having such forms of cancers, or the same person having cancer again and again. We recently had a lady around 45 years of age. She has had cancer once in the left breast 2-3 years back, and now again in the right breast she is having cancer. And in cases where the same person can have different types of cancers, very commonly we see ovarian cancer and breast cancer happening in the same patient again and again. And in cases of cancer which happens in children, not all cancers but typically cancers of the eyes and cancers of the brain and all those, especially in children, and sometimes blood cancers also might be associated with such genetic forms of cancers. Also, many times we might not have very overt features outside. Many findings in the biopsy of the tissue of cancer, certain rare findings if we see, are also indicative. In such cases, we might have to look at your reports also to see if you are at risk. And obviously, when multiple members of your family are affected with cancers, then also you are at a very high risk, especially when they are close relatives of you, especially when your parents or siblings or children are affected, then the others are at risk.
Doctor, what genetic testing can do and cannot do?
So, like we discussed, all those individuals who are at risk have to ideally undergo a genetic testing. But the main thing to understand is that the positive reports and negative reports all have their own pros and cons. For example, if you have a positive reports, meaning we found some genetic form or genetic cause for the cancers running in your family, it does not mean that you are anyway going to get cancer. It only means that you are at a higher risk of getting these cancers when compared to others. Why? Because we already mentioned that there are lots of different proteins which are actually protecting against cancers. Just because one of them is defective does not mean that you are completely unprotected against cancers. The remaining proteins will continue to protect you. So it does not mean that you will anyway get cancer, but you are at a higher risk. So in response to that, what we can do is that we will know based on what protein is affected, we will be able to know at what age, what particular cancer you are at a higher risk of. Based on that, we have specific surveillance protocol. For example, once we find some genetic problem, we do not intend to give the protein from outside, the normal protein from outside, or we cannot go to the gene and do gene therapy or correct that DNA and all. What we can do is, based on the risk profile associated with that protein, we will be able to keep on screening you, and if some changes happen, even before it turns cancer, many times we are able to pick it up and prevent and treat it in a timely manner. So that is what we do in a positive test. So even if you have a positive test, it does not mean that you will surely have it. That is one thing. And even if it is a negative test, that again has to be stressed enough. Even if you have a negative test, it is not a predictor that you are never going to get any cancer. Everybody is at a very low risk of getting cancers, even if you do not have a family history. That risk is there for you for sure. But whenever we do this test, we can identify that you might not be at a very high risk of getting these cancers, especially when multiple family members are affected. We can tell that, okay, When compared to them, you might not be at a very high risk of getting this cancer. Even if you have a negative report, it does not mean that. So what we do is, even if you get a negative report, we reassure you that we don't have you don't need to worry much, but we still keep you under follow-up for an empirical risk based on what your family history has been. For example, if someone is coming to us with multiple history of breast cancers in family, and we find that their genetic testing is normal, we still recommend that they do the routine breast examination, self breast examinations, mammograms and all once in a year or so, just to keep up for their baseline risk. Although they are not at a very high risk, their baseline risk is higher than normal individuals, so we still recommend that. So neither positive report nor negative report are absolute in these cases, and this is something that you should understand while doing the test or getting the test done.
Doctor, how results change care and practice?
So, if you have a positive report, so we have multiple things that we change in the management. The first thing, for the person who is affected with the cancer, if she is found to be positive for a genetic condition or a genetic form of cancer, the treatment might change. For example, many times in early stages of cancer, we only need to do the surgery and remove that cancer tissue, right? But if it is proven to be of a genetic type, there is a high risk that there can be a recurrence in the rest of that breast, and many times we uh, recommend that instead of the small or the lumpectomy or the small surgery that we do just to remove that cancer tissue, we recommend that they go for a larger surgery and remove the whole breast, because they are at a higher risk of getting it again. That happens only if it is a genetic form of cancer. That is one thing. Also, another thing is, certain forms of genetic cancers have specific medicines also. Very commonly in colon cancers, if it is Lynch syndrome and certain tests are positive for genetic forms, we have certain specific medications that we can give specifically for these cancers, and they have a better outcome or better prognosis when compared to others. So the medicine, the primary treatment itself for the patient changes in many cases. Also, for these patients, there is a risk of them getting cancers again and again, right? So based on what has come positive for them, we start them on a surveillance protocol. Whatever cancer they are at risk for, 6 monthly we keep on screening them. And there are many times prophylactic measures also. For example, in HBOC cases, like we discussed earlier, BRCA1 and BRCA2, even though they might not have had cancer in ovary or so, but still, mostly usually after post-menopausal age, we recommend that they remove their ovaries because they are at a high risk of cancer. So prophylactic surgeries or preventive surgeries, they might be normal now, but since they are at a high risk of getting surgeries there, they might choose to remove these organs earlier itself to bring down the risk. So these are the changes that happens in the management of the patient who has the cancer. In addition, like we mentioned earlier, all the first degree relatives, the parents, siblings and children of those affected are at risk, and we would test them also for this same defect that has been identified in the person with cancer. And if they do not have this defect, that's fine, they don't need to do anything else. But if they also have, or some of them are identified to have the same defect in the DNA, then they also need to undergo 6 monthly screening for these cancers. In addition, if some of them is planning their pregnancy or family planning is being done, we have measures to prevent it being passed on to their baby also. So these are the things that we usually do in positive cases. In negative cases, like we mentioned earlier, it is a stress reliever for many families. We have had so many patients, at least 100 patients in the last 2 or 3 months, who have had come with this concern of family history of cancers, and we were able to get their tests done. Their reports were normal, and we were able to reassure them, and they often say that they are relieved of their anxiety. So that is something that we are able to do for negative reports also.
Doctor, could you please explain what are the common myths regarding hereditary cancers?
So one of the common misconceptions that we see is that uh, many people are aware of breast cancers being genetic, because there has been a lot of campaigning and lot of awareness circulated uh, regarding it, but many people think that only breast cancers can be genetic. They are not aware that colon, ovarian cancer, brain cancer, lung cancer, all those things can be genetic in nature. So that is one thing that we commonly see. So it is important that people recognize that even other forms of cancer can very well be genetic and very commonly also genetic. So it is not that the other cancers, genetic cancers, are rare. Other than breast cancer, other organs are very commonly affected by genetic cancer. Another common myth or misconception that we commonly hear is if it is a genetic form of cancer, then everybody is going to get it. So this is not true, because no two-person gets the same DNA, right? Everybody's DNA is different. Usually in first degree relatives, only 50% of the DNA is shared between two. So if you take two siblings or a parent and a child, all of their DNA will be 50% common but 50% different. So that means that even if one person is having a genetic form of cancer, the other family relatives or first degree relatives are only at a 50% risk of getting the same DNA defect. So it is not true that if it is genetic, everybody will get it. If once we detect some form of genetic type, and we will test all the others to find who else is at risk, and based on that only we will be assessing who is at risk of getting these cancers. So another common myth is that once we are identified to have a genetic form of cancer, you will surely get it, right? Again, we have already addressed this earlier. Even in the worst forms of, or the genetic types of cancers with highest recurrence risk or highest cancer risk, we only see around 80% of cancer risk. So it does not mean that, so even if it is a genetic form of cancer, it does not mean that you are 100% going to get it. But with proper surveillance and screening and the prophylactic measures, preventive measures, lifestyle changes, we are able to prevent these cancers in a lot of individuals, and in the rest of them we are able to pick it up at a very early stage and prevent life-threatening complications resulting from it.
Doctor, could you please tell what the process actually looks like?
Yes, so whenever we have an individual or a family coming to us with such history, the first step is to take a proper history and collect as much information as possible. So we'll draw a pedigree or a family tree and find out who all are affected with what types of cancer at what age. If we have their reports, that is even better. Once we have all this information, we'll be able to risk assessment can be done for the individual visiting us. We usually classify them into a high risk individual or a low risk individual. In low risk individuals, we do not recommend any forms of genetic testing, and they can only take up normal or routine surveillance and cancer prevention methods like do not smoke, no alcoholism, lifestyle changes, exercise, junk food and burnt food. All these things should be avoided. So that only would be told to them. But for the high risk individuals, we would recommend a genetic testing. In genetic testing, it's a simple blood test. We take the blood sample, we extract the DNA, and we check all the genes associated with this hereditary cancers. If all are normal, you will get a negative report and nothing else has to be done. But if it's a positive report, like we told earlier, the different management changes or different surveillance changes, family screening and all would be advised by us.
Doctor, as we wrap up, what key advice would you give listeners regarding hereditary cancers?
All cancers are not genetic or hereditary in type, but around 5 to 10% could be, and in those individuals there is a great change in the treatment, surveillance, family planning, family screening, preventive measures, etc. So it is important that these individuals are identified early. Even if you are affected with the cancer, or if you are a family member of someone affected, it is important to get tested. So I would recommend each of you who think that you have one of these red flags that we had mentioned earlier to consult a clinical geneticist on how we can help you.